हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। नेजल पॉलिप्स आर कॉमनली एसोसिएटेड विद intrinsic asthma. Here the answer, because the nasal polyps are mainly associated with intrinsic asthma. Intrinsic asthma is a characteristic by the presence of asthma with negative skin prick test for common antigen. The association of the nasal polyps with asthma is described by the which triad? Samtius triad is the इंटेंसिक अस्थमा. सैम्टियस ट्रायड में क्या क्या होता है? इंटेंसिक अस्थमा प्लस एस्पिरिन प्लस हाइपर सेंसिटिविटी प्लस नेजल पॉलिपोसिस. अस्थमा इज यूजुअली सीवियर परसिस्टेंट एंड एडल्ट ऑनसेट. नेक्स्ट क्वेश्चन, ऑल ऑफ द फॉलोइंग आर एआईडीएस डिफाइनिंग इलनेस एक्सेप्ट encephalopathy attributed to HIV, cervical cancer, mycobacterium tuberculosis, of any site, oral candidiasis is the correct answer, because the oral candidiasis, although seen in AIDS patient, is not an AIDS defining illness. Candidiasis of the esophagus, trachea, bronchi, lungs and other defining illness. AIDS defining illness are specific opportunistic infection in a patient with AIDS, with this signifying an advanced stage of illness is most the stage 3. Next question, a 47-year-old man with a diagnosis of acute myeloid leukemia with a blood type O negative blood group present to the transplant clinic. Discuss proceeding with an allogenic stem cell transplant. Which of the following would be optimal donor? His identical twin brother, umbilical cord transplant? No. His identical 50-year-old brother who is other alien O positive. Here the answer, because the allogenic stem cell transplant are the treatment of the choice. His HLA identical 50-year-old brother who is blood type O positive would be the best choice, and in the identical twin brother would not be the donor of the choice. The therapeutic benefit of the stem cell transplant in hematological malignancies is due to the draft versus leukemia. In autologous umbilical cord transplant, in autologous umbilical cord transplant, also known as the autologous, is not recommended in higher rates of the relapse have been reported. So answer is the his HLA identical 50 years old brother who is otherwise healthy and is blood O positive. Next question, alert to about Guillain-Barré syndrome. Axillary inflammatory condition, descending paralysis is seen. Plasmapheresis is a treatment method. Demyelinating disorder. So the except with the descending paralysis is seen, because the ascending in Guillain-Barré syndrome was seen ascending, not descending, it generally benign in the bilateral lower limb, ruby legs, affecting both proximal and distal muscle and ascend to the inverse and trunk and upper limbs. GBS is an acute autoimmune inflammatory demyelinating polyneuropathy. The usual presentation is symmetrical ascending paralysis involving over hours or to few days. There is usually no progression beyond 4 weeks. The legs are usually more affected than the arms. It is associated with autonomic dysfunction. Next question, which of the following is the best treatment relapse of immune thrombocytopenia purpura? IV immunoglobulin, steroid, splenectomy, blood transfusion. Splenectomy is the answer, because the splenectomy is the treatment of choice in acute for the relapse of immune thrombocytopenic purpura. Relapse after the first line therapy here with what? Glucocorticoids. The relapsing usually occurs once they tapered vaccination against which encapsulated organism like pneumococcus, meningococcus and H influenza is the advice before splenectomy is performed. Next question, which of the following cardiac chamber is enlarged in mitral stenosis on chest X-ray initially? The left atrium. Left atrium is the first cardiac chamber to get enlarged in mitral stenosis. It is due to the pressure overload of LA. Left atrium, it can be appreciated on the lateral and left anterior oblique views. Next question, which among the following is false? Component of mild stage liver disease scoring system or kidney bilirubin international normalization, correct. Component of CTP child tumor score Turcotte-Pug score are albumin, bilirubin, yes. Component of CTP, chat Turcotte-Pug are kidney bilirubin international normalization ratio. This one is the answer because this one is the false. The child Turcotte-Pug score does not include what? Creatinine. Creatinine non-include. The component of the CTP score is what? Albumin, bilirubin, international normalization ratio, ascitic and encephalopathy. Next question, identify the false statement about the bundle of Kent. It is slower than AV nodal pathway. This was the answer because the bundle of Kent is accessory pathway is conduction between the atria and the ventricles is Wolff-Parkinson syndrome. It conducts impulse faster than the AV nodal pathway. At avoids to the AV nodal delay leading to the shortness PR intervals. QRS is prolonged because of the AV nodal impulse reaching in ventricles after the aberrant impulse. What is the Wolff-Parkinson syndrome? It's characterized by the abnormal accessory pathway in the heart leading to arrhythmias. Pathology bond with the accessory pathway, the bundle of Kent which connect the atria and ventricle, the electrical impulse from the SN node reach the ventricles via the accessory pathway, as there is no AV nodal delay in the pathway. This leads to the pre-excitation of the ventricles and initiation of ventricular contraction, and the ventricular contraction is prolonged when the impulse via the AV nodal pathway reaches the ventricle. Most common location of the accessory pathway between the left atrium, free wall of the left ventricle, and free wall of the left ventricle. That's all. Thank you and keep revising.